America has a long way to go before healthcare is holistic, even though millions of people have been seeking out holistic approaches for more than 30 years. We're going to take a look at the key events in history that have left us where we are now. The story starts with two Frenchmen, Louis Pasteur, a chemist and microbiologist, and Antoine Beauchamp, a physiologist. Pasteur strongly believed in the germ theory, the idea that an outside germ was responsible for illness. Beauchamp believed in the internal healing environment, which he felt was much more important than an external germ. As Pasteur lay dying of pneumonia, he realized that his life's work and focus on the germ theory was incorrect. The dying Pasteur renounced his long-held theory and said, quote, "The internal healing environment is more important than the vector," unquote. The vector referred to a germ. Pasteur became well known in history, and Beauchamp became an afterthought in history. Medicine, which is illness care, not health care, has pushed the germ theory and continues to. In 2008, I developed the first cause and effect map of chronic illness. The health map acknowledges the value of Pasteur and Beauchamp. There are three main levels in the health map. Level 1 has to do with primary causes. In the health map, level 1 includes Pasteur's germ theory. There are close to 40 categories of primary causes, but the main ones are toxicity, infection, poor diet, obesity, lack of exercise, genetics, stress, and electromagnetic fields. The action starts with level 2, which is how the body responds to primary causes. Level 2 has to do with the internal healing environment, which supports Beauchamp's theory, although I did not know about Beauchamp in 2008 when I created the health map. Level 3 is metabolic chaos, which involves disturbances of biochemistry, which is mainly amino acid chemistry, and disturbances of bioelectrical fields. Rockefeller medicine mainly addresses level 1, primary causes. Around 1890, scientists discovered that a wide variety of chemicals could be made from oil. Oil tycoon John D. Rockefeller, founder of Standard Oil, was looking for ways to make greater profits from oil. He approached the drug companies and made an offer which went something like this: "If you can make drugs from my oil, I will fund medical schools, textbooks, medical libraries, hospitals, and medical conferences." Rockefeller hired educator Abraham Flexner to put together a document that would change the face of healthcare. The Flexner Report, released in 1910, stated that natural, holistic treatments were unscientific quackery. During the 1800s, almost half of American medical schools were homeopathic. Part of Rockefeller's plan was the creation of the AMA, the American Medical Association. One of the main goals of the AMA was to wipe out all the homeopathic medical schools. At the time, holistic and homeopathic approaches were popular. At the time, the term homeopathy referred to all natural, non-drug treatment modalities. Almost half the doctors and medical schools in America used natural treatments and practiced holistic medicine. Rockefeller arranged to close all the homeopathic medical schools in America and replace them with Rockefeller medicine. He donated $100 million to hospitals and medical schools. He also was determined to discredit chiropractic medicine. Early on, the AMA referred to chiropractors as rabid dogs, and they attacked chiropractors as killers. The new AMA prohibited MDs from associating with chiropractors. Many doctors practicing holistic or homeopathic medicine were jailed. Rockefeller medicine is still the healthcare system of America. It is a system that promotes Pasteur's germ theory and opposes all natural and holistic approaches. A medical student has no idea that the textbooks he or she studies are part of Rockefeller medicine. Rockefeller medicine is a system to generate huge amounts of money by turning oil into drugs. The medical-industrial complex, also known as Rockefeller medicine, is all about money. It is not about healing and curing. Most medical students and doctors have no idea that the conferences they attend and the textbooks they study are funded by Big Pharma. Most conventional doctors don't have any understanding of Rockefeller medicine, which is still firmly entrenched in America. Holistic, natural, homeopathic approaches have not been taught in medical schools since Rockefeller. And holistic doctors have been under investigation and attacked by state medical boards for a very long time. On January 17, 1961, in President Dwight D. Eisenhower's farewell address, he said, quote, "We must guard against the acquisition of unwarranted influence, whether sought or unsought, by the military-industrial complex," unquote. Inspired by that term, the 1971 book, The American Health Empire by Aaron Reich, wrote about the medical-industrial complex. The medical-industrial complex now includes Big Pharma, the FDA, DEA, CDC, APA, which is the American Psychiatric Association, AMA, health insurance, state medical boards, and the NIH, the National Institutes of Health. The influence of Big Pharma goes far beyond these institutions. In 2020, Big Pharma spent $30 billion on drug marketing. $20 billion was used to persuade doctors about drug benefits. Billions of dollars are paid for television ads in which the narrator speaks in a soothing voice while rattling off a list of serious side effects. The ads end with the words, "Speak to your doctor to see if drug X is right for you." Big Pharma has been paying doctors to believe in their drugs, so TV advertising that says, "Speak to your doctor," works perfectly for Big Pharma. In 2017, 72% of commercial breaks on CBS Evening News were for drugs. In 2019, Democrat legislators received $6.6 million in contributions from pharmaceutical companies, and Republicans received $7.1 million. Prior to the 2020 election, more than two-thirds of members of Congress received checks from Big Pharma. In 2020, Pfizer, which played a big role in the creation and distribution of the COVID jab, donated up to $1 million to 228 members of Congress and wrote checks for 1,048 candidates in state legislative races. Over the decades, healthcare became a financial enterprise that involved Big Pharma and a host of three-letter governmental and private agencies. If you are a holistic doctor, chances are that you've been investigated by your state medical board. The FDA and Big Pharma are very closely related. When an FDA executive retires, he or she often becomes an executive in Big Pharma. And when a Big Pharma CEO retires, he or she often becomes an FDA executive. It's a revolving door. The FDA's open belief is this: only drugs heal. Herbs and nutrients don't heal. By FDA definition, herbs and nutrients cannot heal. Only drugs can heal. Doctors who claim that a certain vitamin, mineral, amino acid, or other nutrient can cure something is likely to be targeted by the FDA for promoting a fraud. In my medical school, I had a single 2-hour course on nutrition. This system was not created by doctors. It was created by oil billionaire John D. Rockefeller, the new medical schools, and Big Pharma. A pill for every ill became the motto of modern medicine. Rockefeller medicine succeeded in wiping out natural healing approaches, including nutrition. A handshake between Richard Nixon and Edgar Kaiser in 1973 cracked the foundation of healthcare as we knew it. That handshake led to managed care, a system in which healthcare decisions that had been made by doctors are only permitted by accountants, attorneys, and financial analysts, thereby stealing the soul from healing. Instead of improving the art and science of healing, doctors have had to perfect the art of defensive medicine, and nurses spend an hour a day making sure that the patient's chart is cured, while that patient could benefit much more from the nurse's touch. From that handshake between Nixon and Kaiser, managed care started springing up around the country. When I was in medical school, there was a psychiatry joke going around, which went something like this: surgeons know everything and do everything. Neurologists know everything but do nothing. Psychiatrists know nothing and do nothing. Psychiatrists desperately wanted to be in the same club as other Rockefeller medical doctors. They didn't want to be connected with psychotherapy, so they approached the drug companies and said, "If you can make psychiatric drugs, we will use them." In 1986, Congress passed a law that protects vaccine manufacturers from being sued in civil personal injury and wrongful death lawsuits resulting from vaccine injuries. The law was called the National Childhood Vaccine Injury Act of 1986. Moderna, Pfizer, and Johnson & Johnson are currently protected by that law. Around 30 years ago, psychiatry residencies discontinued training in psychotherapy. The change had nothing to do with healing and curing and everything to do with money. It costs more to train a psychiatrist in psychotherapy than not to train in psychotherapy. The incentive for the plan was that psychiatrists would be paid $150 for a 15-minute medication visit. If a patient needed psychotherapy, they would be referred to a social worker or an MFCC. Of course, they would be paid much less than a psychiatrist. I knew this change had gone on because many people sought me out after feeling traumatized by their psychiatrists, and patients didn't feel a connection with their psychiatrist. I went to UC San Diego psychiatry residency because half the training was in psychotherapy and half was in physical treatments, mainly medications. Drug treatment eventually became amino acid therapy for me, and traditional psychotherapy became strategic mind-body therapy. The new psychiatrists of the 21st millennium don't know what they don't know. They don't have any idea what psychotherapy is, and they will medicate any emotion, thought, or behavior that they deem to be abnormal. Many people bought into the APA's marketing of mental illness as a chemical disorder that had nothing to do with one's mental state, traumas, and conflicts. With very few exceptions, health challenges, whether mental or physical, involve mental and physical causes. The APA wanted people to believe that talking with their doctor about their emotions, traumas, purpose, relationships, and goals has nothing to do with their healing. Prozac sold a new model of healing that excluded psychotherapy and the healing power of the doctor-patient relationship. The advent of Prozac was a major contributor to the current state of psychiatry. Eli Lilly manufactured Prozac, and the FDA approved it in 1987. After Eli Lilly had completed clinical trials, they submitted the information to the FDA, and the FDA quickly denied them. The drug was no better than a placebo. Eli Lilly submitted clinical research findings to the FDA over and over again, and the FDA denied the approval of Prozac over and over again. So Eli Lilly stopped doing clinical research and hired statisticians to juggle the data. The FDA continued to deny Prozac. This went on for years. Finally, Eli Lilly hired a statistician who made an adjustment that led the FDA to just barely approve Prozac. Prozac was created following Dr. Candace Pert's discovery of the endorphin receptor site. Her discovery inspired a new generation of drugs, the SSRIs, which work at the serotonin receptor site. Prozac was the first drug manufactured to fit into a receptor site. The truth is, that the SSRIs work at the serotonin, dopamine, and norepinephrine receptor sites. They are not selective, and their side effects can be fatal. I want to be clear that Dr. Pert had no involvement in the development of Prozac. Paxil arrived right after Prozac. It could not compete with Prozac as an antidepressant, so it was marketed for social anxiety. Social anxiety as a symptom became social anxiety disorder, the disease. The SSRIs increase serotonin for only 3 weeks. After that, there is a permanent decline in brain serotonin levels. In addition, the SSRIs lead to a 40% decrease in serotonin receptor sites. The marketing of Prozac and other SSRIs was massive, starting with a cover story in Newsweek magazine. When Prozac was released, Dr. Louis Judd, who was president of the American Psychiatric Association, or APA, he announced, quote, "We now know the cause, the chemical imbalance of every mental disorder, and we have the treatment for every disorder," unquote. That comment was definitely not true. Psychiatry first tried to market mental illness as a genetic disorder, but that did not prove to be correct. So psychiatry changed its marketing and declared that, quote, "All mental illnesses are a chemical imbalance in the brain," unquote. That also was never proven to be true. Even though psychiatrists believe that mental disorders are caused by a chemical imbalance, almost all psychiatrists believe that there is no way to test for neurotransmitters. There are several ways to test for neurotransmitters, including amino acid analysis, which are the precursors of neurotransmitters, urine organic acids, the breakdown products of neurotransmitters, and blood platelet levels of neurotransmitters. Along with Prozac marketing that was aided by the American Psychiatric Association, Americans were told that almost everyone is depressed, even if they don't know it, and everyone should consider taking Prozac. Psychiatry is big business. In 1989, several hundred Americans developed eosinophilia myalgia syndrome, or EMS, whose symptoms are peripheral neuropathy, eosinophilia, and skin induration, which is hardening of the skin caused by inflammation. 17 people died from EMS. The 1989 EMS outbreak was linked to a bad batch of tryptophan that came from the Shoyo Denko Company in Japan. The FDA quickly determined that tryptophan was not the culprit. Shoyo Denko was. But the FDA banned tryptophan until 2005. People whose lives had changed for the better thanks to tryptophan suddenly found themselves without a vital nutrient. Several years after the ban, the FDA granted partial approval of tryptophan, but only through compounding pharmacies. That meant that if you needed tryptophan, you had to pay a doctor who would write a prescription, and then you would have to pay the higher prices of a compounding pharmacy. The timing of the tryptophan scare coincided with the launch of Prozac, and in one major magazine, Prozac was featured as the greatest thing that ever happened to the world, and tryptophan was portrayed as a deadly non-drug treatment. During the 1970s and 80s, there were a number of amino acid experts in the United States. When tryptophan was banned, many of those experts said to themselves, "If the government is targeting tryptophan, they're coming after me next." So many amino acid experts simply retired. That's why you're watching this video. The fake tryptophan story led to a loss of most of the amino acid specialists. With COVID-19, the entire medical industrial complex went into high gear. Everything I've said about doctors losing autonomy to practice medicine the way their intelligence, experience, and conscience dictates is in high gear. While numerous doctors have had success with vitamin D, zinc, and 2 drugs whose names I won't mention, information about these nutrients has been quickly deleted from the internet. Doctors are no longer able to safely share what their personal research and experience has shown them. Rockefeller medicine goes back 110 years, but it never disappeared. The worst aspects of Rockefeller medicine are now dictating what doctors think, how they prescribe, and how they practice medicine. Let's return to the question, why don't doctors know anything about nutrition? Here are 6 parts to that answer. 1. Rockefeller medicine was created by John D. Rockefeller as a business model to turn oil into drugs and to make huge profits on drugs. 2. Rockefeller medicine wiped out homeopathic and natural approaches. Legislation has made the life of holistic doctors very difficult. Rockefeller medicine is not about helping, caring, curing, or preventing illness. It's a business. Your doctor is probably part of that business model, and he or she is probably not aware of that fact. 3. Rockefeller medicine intentionally targeted and destroyed healing approaches that did not fit into John D. Rockefeller's vision. The medical industrial complex is not a friendly place for holistic doctors, doctors who are true healers, or doctors who are pioneers and think for themselves. 4. The current state of medicine has arrived at the point where doctors have less and less autonomy. In this time of COVID, doctors have lost even more autonomy. They can't prescribe what they feel is the best treatment. Doctors have been coerced to diagnose diseases from car accidents to strokes and change the diagnosis to COVID. Several doctors who refuse to change a death certificate have had their medical license revoked by a state medical board. 5. Marketing by the American Psychiatric Association, which relied heavily on selling Prozac, helped delete psychotherapy from the job of psychiatrist. Millions of Americans stopped thinking of their emotions, diet, exercise, lifestyle, unresolved conflict, stress, relationships, and trauma as part of why they suffer. Almost all mental conditions have physical causes, along with mental emotional causes. 6. Rockefeller medicine has not made America the healthiest country on earth. We spend the most money in the world on our healthcare system, but American medicine is far from the best. In 2017, the United States healthcare system ranked last among 11 major industrialized countries. Studies done over the last 20 years show that approximately 100,000 people die every year from the correct use of prescribed medications. A 2020 study by Yale Medical School said that deaths by medical error could be as high as 250,000 per year. Internet searches of the top 10 causes of death in America do not include death by prescription drugs or medical error. However, it is likely that death due to medical error is the 3rd leading cause of death in America, and death from the correct use of prescription medications is probably the 4th leading cause of death. When I see or hear people ask, why don't doctors know anything about nutrition, I sense that there is something more to the question. People wish that their doctors knew about nutrition. People who would like nutrition to be part of their healing are not sure what to do with their health or that of a loved one. They want to see a doctor, but they know that it's unlikely that their doctor has had any training in nutrition beyond a 1 or 2 hour lecture in medical school. John D. Rockefeller's vision turned psychiatrists into drug specialists and discouraged psychotherapy and all tools for self-empowerment. What modern psychiatry appears to know is very little compared to what is actually known. Millions of people have gotten educated on their own, and they know things that their doctors have never heard of. There are places for conventional medicine, and I think those places are trauma, surgery, and emergencies. Alternative medicine, which does look at underlying causes, is, in my opinion, best for chronic illnesses. If people have a better understanding of our healthcare system, they will stop expecting doctors to be something they are not. Many people will turn to naturopaths who are well educated in nutrition. People will stop wondering why medical doctors don't know anything about nutrition. In my experience, most of the people who seek out my help know much more about nutrition than most doctors know. It's important that the non-medical public continues their personal study of nutrition and other alternative therapies. Do not change your beliefs and health practices if an ignorant doctor is intimidating you, ignoring your beliefs, or pushing a treatment that really feels wrong for you. The problem is not about you. The problem is about his or her ego and ignorance. Your doctor does not know that he is practicing Rockefeller medicine, and you cannot change that. Conventional medicine tends to be decades behind science, even decades behind Nobel Prize-winning breakthroughs. If your doctor has something to offer you, recognize what the benefits are and find ways to refuse treatments that you don't believe in. If you are a shy person, this is an opportunity to stand up for what you believe. You didn't create Rockefeller medicine, and now that you know about it, you don't have to accept it. Keep learning, keep seeking the truth, keep moving forward, and be your own doctor to the extent that you can. Here's a paragraph from a book I wrote for a United States president sometime over the last 20 years. The book is Prescription for America, and it's not for sale. Quote, I'd like for us to look far into the future for the health and happiness of our great-great-great-grandchildren. We will lay a solid foundation for health and healing, a foundation that absolutely does not exist right now. What exists now is a rigid power structure in medicine that is interested in its own preservation. That power structure will crumble. The foundation of medicine no longer exists. It is not a question of if the power structure will crumble. It is a question of when.